Hi, everybody. Welcome to NAHQ Next, the NAHQ Next info session. We are pleased you are here joining us today. My name is Allison Hiller, and I am the Products and Program Specialist here at NAHQ. I primarily work on NAHQ Next, and I'm excited to be here today. We'll save a few minutes at the end for Q&A from the audience, so please submit your questions at any time during the presentation for us. Before we kick it off, I'd like to introduce our speakers. Terry is the Director of Service Excellence and Patients Experience at Middlesex Health. Terry is also the chair of the NAHQ conference planning team, so she's closely involved in all content for NAHQ Next. Terry has been instrumental in creating this event and working with other subject matter experts to deliver a best-in-class conference, so we are very thankful for her and her dedicating her time over the last 5 years and all of her expertise. Jackie Wigline is the Director of Events here at NAHQ. This is one of our favorite events to collaborate on with our SMEs. The purpose of today's info session is to take a deeper dive on NAHQ Next and discuss why it's the event you don't want to miss and how to make the most of your experience attending it. Before we dig into the content, I'd like to take a poll. Have you ever attended NAHQ Next before? Please enter yes or no in the chat on the right-hand side of your screen to let us know. Nothing in the chat, so I guess we have everybody as a newcomer on this info session. So for our first question today, my next question is for Jackie. There are several events for our constituents to choose from. So why should they participate in NAHQ Next? What makes NAHQ Next stand out from other events?
Thanks, Allison, and hi, everybody. So NAHQ Next is really unique in that we've looked at past attendee feedback from events, and we've looked at all of NAHQ Next research results to ensure that we're really addressing the most urgent and critical topics or issues facing healthcare today. So it's a highly curated agenda. We worked with a group of subject matter experts to design each and every single session. And then we also have calls with every single one of our speakers to make sure that they understand who the audience is and so that they're presenting what will be most relevant to them. So it's highly curated. And then all of our sessions also align back to NAHQ's Healthcare Quality Competency Framework. And so if you know that you have a gap on a specific domain of the competency framework, you can easily go to our agenda, and with a quick icon image, you can see where there's a session that aligns back to the competency domain. NAHQ Next also really focuses, we work with our speakers to make sure that they're providing takeaways, tools, templates, actionable next steps, rather than glossing over the topics that are presented at NAHQ Next. We want to make sure that our attendees are walking away with something that they can implement in their organization and take back to their teams. NAHQ Next is also unique in that each day has a theme, and so each session and each day builds off of the one before it. So we kick off day one where we talk about the challenges we face in healthcare, and we introduce this concept of care, cost, and workforce cliff. And so care is patient care, cost is the high and unsustainable costs of healthcare. And then the workforce cliff is really about the shrinking workforce, and because of the ratio of working people to retired is decreasing, and then the people needing healthcare is increasing. So just to put this into context, I'll share an interesting and somewhat scary thought. In 1950, the ratio was 12 to 1. So we had 12 working people for every one person retired. Today, that ratio is 7 to 1. So 7 working people for every one retired. In 15 years, that ratio is going to be 4 to 1. So 4 working people for every one retired. And then you couple that with those retired individuals, they're going to be needing more healthcare. So you have fewer people working, more people needing healthcare. So that's what NAHQ has is calling the workforce cliff. So we have care, cost, and cliff. And so these three looming challenges, care, cost, and cliff, are significant, and that's what you all are facing each day and struggling with that. But we believe that the opportunity to meet these three challenges with big ideas and bold solutions, and specifically leading with quality and safety, is really going to hold the key to some of the most innovative and effective answers to address care, cost, and cliff. So day one really introduces that concept of care, cost, and cliff and starts to highlight some of the hot topics. And then day two, the theme is work in action. And that's where our presenters will hone in on specific topics and dive into them really deep. So you'll leave day two with great takeaways on some of the hottest topics in healthcare. And then day three is really tying together day one and day two. So it's really all about arming the professionals, all of you, with tools and templates and even soft skills to bring back what you've learned in day one and two to advance your organization, to advance your career, and to advance quality and safety specifically. So that's in a nutshell, what I think makes NAHQ Next unique. And we've worked really hard with our SMEs to make it stand out from other events.
Great. Terry, you've been the conference planning chair for the past 2 years and on the planning teams for the past several years. I know you've attended many NAHQ Nexts. What about this year's program excites you the most?
What excites me most about NAHQ Next is a sense of community with other quality and safety professionals. You might be surprised for a virtual conference how engaging this conference really is. There's also restored passion and energy to make a difference. I expect to learn from experts who are high caliber speakers, presenting on the most important topics and sharing their best practices. It's an event for everyone. If you're a leader, it helps you lead. If you're a contributor, it helps you be an asset on your team. Regardless of where you are in your career, there's something for you at NAHQ Next. There will be takeaways, and as Jackie said, that's part of the abstract when they submit, is what is going to be that takeaway for the audience. So there will be takeaways to implement in my organization so I can make a difference to advance our healthcare, our outcomes, and the quality profession. And it's a great opportunity to steal shamelessly. I always recommend that to our team. I know there will also be professional development for my personal growth as well as our team.
Great, thanks, Terry. I'm going to turn it back over to Jackie. Discuss with us the different types of sessions at NAHQ Next and how the agenda is organized.
So the agenda is really organized into 4 different types of content. We have the virtual live sessions, and the virtual live sessions are scheduled at a specific date and time to really encourage everyone to come together and to participate and create that sense of community, which I know is challenging in a virtual environment. So they play back at a certain date and time, and we really encourage everyone to participate during that date and time so that you can engage in a chat. And if you've ever participated in NAHQ Next before, you know that the chat is very lively, very busy. And then also after the session, we have live audience Q&A. So it gives our attendees an opportunity to ask questions to the presenters and get some of their questions answered. And then in addition to the virtual live sessions, we have 60-minute on-demand sessions. And then we also have 15 minutes sort of bite-size, we call HQ best practice tools. And so the best practice tools, one of the great things about these is when the presenters submit their abstract, they are required to also submit the tool that they're going to talk about, and then they also have to submit that as a handout for attendees. So you'll walk away with those 15-minute HQ best practice tools with an actual tool template sample that you can take back to your organization. And then we also have posters, and it's not just a static poster. Each of the poster presenters has to submit no more than a 10-minute video, which is a summarization of their poster, just sort of bringing it to life a little bit more for the attendee since it's virtual.
Great, thanks, Jackie. Terry, as chair of the conference planning team, you are deeply involved in the content and speaker selection for this event. Talk to me about how NAHQ selects the sessions and speakers for this event.
Thanks. So NAHQ has created a platform with a scoring grid for the NAHQ volunteers to evaluate and score the abstract submissions. NAHQ does a great job making this platform user-friendly for those reviewing the abstracts. Each volunteer had 45 abstracts. In addition, the chair and co-chair review 100% of the abstract submissions. This year, there were 205 abstracts submitted and 78 were selected. The group is very mindful to include topics that would be of value to the quality professionals at all stages of your career, as well as including different settings across the transition. And I want to give a special shout out to the team of volunteers. This slide is showing you the volunteers for our teams. And I'd also like to thank our co-chair, Liz Carlton. We're very fortunate to have NAHQ volunteers between the conference planning team and the abstract review task force team who have dedicated their time to review abstracts. They not only score the abstracts, they provide written feedback as to why they scored a particular item. This is very helpful. I would like to thank each and every one of them for their contributions for making NAHQ Next a conference that you don't want to miss. It is certainly a team effort, and we couldn't do it without the help of NAHQ staff, Allison and Jackie as well. So thank you, Allison and Jackie. I encourage you to consider submitting an abstract for NAHQ Next 2025. It's not too early to start thinking about that. It's a great opportunity to showcase your improvement work at a national conference. If you have any specific questions about this, please reach out to NAHQ. The call for abstracts will open in January through March of 2025. The exact dates will be published on the NAHQ event page, and there is a link to the NAHQ event page on this slide.
Thank you, Terry. And thank you to all our volunteers that helped us out this year and all our other years of NAHQ Next. Jackie, while it's not the same as being in person, how does NAHQ create an interactive event where you can network with speakers and other attendees?
Thanks, Allison. So it is challenging to make a virtual event engaging and create that sense of community. So one of the things we do that I mentioned earlier is we have live audience Q&A. So at the end of the sessions, those live virtual live sessions, you have an opportunity to ask the speakers questions. Another great thing about NAHQ Next is the lively chat that I mentioned earlier. So a lot of people will just get on in the morning and say, "Good morning, it's Jackie from Iowa," or they may say, if a presenter is sharing an article, they may share another reference that other attendees could use, or they may say some of their takeaways at the end of the session. So it's a great opportunity to connect with others listening to the session and get some takeaways from that aspect of the event as well. And then for the last couple of years, NAHQ has done dueling pianos during lunch breaks, so we're bringing those back. Those are live, and attendees have an opportunity to request their song. So a lot of people just take that lunch break to catch up on emails or eat lunch with their team if they're participating in a team, and then keep that music going in the background. It's a great way to kind of pump up the spirit during lunch. And then also our platform has interactive attendee profiles. And so there is a tab at the top, I think it's called My Account or Attendees or something like that. And you can click on that and you can connect with other attendees. You can search by name and you can video chat them on the platform. You can send them a message. And also if you don't want to make your profile public, you can also hide it, or you can include as much or as little information as you want, including like an avatar or a headshot. So it's really up to you to make it as interactive as you want. And then share your engagement on social media. We love to see groups, individuals with a picture of them participating in NAHQ Next on social media. Oftentimes we will reshare that or use that for other purposes. So we just love to get the word out there that we are collectively participating in this event to advance quality and safety.
Great, thank you, Jackie. One of the great benefits of NAHQ Next, I think, is the accessibility. As far as how long you have access to the event, we know our audience is busy. We know you can't always make it during those 2.5 days, even though it is fun to be there in the chat and participating live. But the good thing about NAHQ Next is that we do have it available after the fact. So Terry, talk to me about how attendees can access the event both during and after the live event on September 9th through 11th.
We are very fortunate that NAHQ extends access to the end of 2024 for all of the sessions. It allows us time to review sessions that we could not attend during the NAHQ Next Live sessions. In addition, it gives us the opportunity to review a session again if we wish. The virtual live sessions will be available approximately 1 hour after the session ends. The platform for NAHQ Next is also mobile friendly, so you can listen to it on your device. For those who are CPHQs, the conference does offer CPHQs for participating in the sessions, but I absolutely love that we have till the end of December to access everything.
Yeah, and especially how quickly we put the sessions up. Even if you miss, an hour for a meeting, you could probably still finish by the end of the day. Okay. Jackie, can you let us know how someone can register and how registration works for a group?
Yes, happy to. So exciting. We have about 3,500 people currently registered for NAHQ Next. So that's great. And registration right now, you can visit the NAHQ Next specific website, which is listed here, nahq.next.org/register. Or you can also use this QR code here on the slide. Just take a picture of that with your phone. And then from there, you'll select your reg type, either individual or group, and then you just walk through the checkout process. So it will ask you some demographic questions, and you do not have to register. You don't have to sign up for specific sessions at this time. You can just simply register for NAHQ Next in general as an event, and then on the day of or a few days before, whatever, you can go back in and kind of mark on your calendar which individual sessions you do want to register for. And then I mentioned registration as a group or individual. So NAHQ is a great event to attend as a group. We hear from many groups that attend together, and Terry's going to share in just a minute here some specific examples about how her and her team participate to make the most of their experience together. But we do have special pricing for groups as small as individuals, as small as 5 individuals, you can see here. And so I have the prices broken out on the slide. So you can see the more individuals you have participating, the deeper the discount. And these prices are good until end of day tomorrow. And then after that, our early bird closes and the rates will increase. And one question we always get about groups is, if I participate as a group, will I still get my own personal CE? And yes, you do get CPHQ CE, nursing contact hours, and the ACHE hours, even if you participate as a group. And then I also have individual registration pricing listed on this slide as well.
Great.
So don't forget to register.
Yeah, definitely don't forget. And I've dropped the link in the chat in the box on the side if you want to click that to register. And Terry, talk to me about how you, as a busy healthcare quality professional, ensure that you are dedicating time to the event and how you engage your team to participate.
Thanks. So it's important to reflect on how you will prepare to get the most out of the conference. And we know how quickly our calendars fill up with meetings. So I actually start by blocking off my calendar, and I've already blocked it off for those 3 days. I also download the program guide once it's available, and I go through it and I will highlight the sessions that I first want to make sure that I attend. I will write down my takeaways for each session, and I try to do it in a Google document. So rather than putting it on a pad that will then get lost somewhere, I do it right there on a Google document. I love the option to replay sessions that I found valuable. So I'll try to block out some times where I can listen. I also do it at home many times just to re-look at some of those sessions, and then I may add to my notes. I schedule a meeting with my quality colleagues so we can share our takeaways and discuss what we can steal shamelessly. And that's the best part of the whole thing. You are going to get so many takeaways and so many tools that you'll be able to use right in your organization. I also like to take note of the speakers and attendee contact in case I want to follow up with them for any questions. And I have done that multiple times, and everybody is so welcoming to get those questions and to know that their session has been important to you. It's also important as leaders to assist your team in preparing for NAHQ Next. So ensure everyone from your team is registered, or in our case, we had our administrative assistant register us as a group. You may consider reserving a room so that everybody can listen to it together, especially those live sessions. We know everyone loves food, so if you have it in your budget, take advantage of this opportunity to order some lunch for your team. We'd like to ask each staff member to share their favorite session and why post-conference. This ensures that they're going to be engaged in the conference and that they have some accountability for their learning so they can share their favorite session. We will schedule post-event meetings to discuss what we've learned that we can implement to improve care at our organization. And then we will have another group session to see what should we focus on first to make those changes.
Great, thank you so much, Terry. It sounds like a good couple of days for your team. I'm going to turn it back over to Jackie. We know that many of our constituents rely on NAHQ for their CE fulfillment. Tell us what types of CE are available, how many, and how you can claim the awarded CE.
Sure. So this is one of the most frequently asked questions we receive, and we understand why. CE is important to you. And one of the great things about NAHQ Next is if you're due to recertify for your CPHQ, you can get all of your hours from attending 1 year of NAHQ Next. So it's approximately 40 hours of CPHQ and nursing contact hours, which we're in the process of being approved right now. And then also 20 hours of ACHE credits as well will be awarded. So just make sure that you listen to the sessions, you complete the evaluation, and then upon completion of that evaluation is when you'll be awarded your CE. You'll get your certificate with the breakdown of CE hours.
Great, thank you, Jackie. Once someone registers for the event, then what? When will they receive access to log in? And can you tell us about that, Jackie?
Sure. So right after someone registers, they'll receive 2 confirmation emails. One will be a receipt for your records in case you need to submit that for reimbursement or what have you. And then another thing you will receive is a second email with kind of a checklist to make the most of your experience. So it just has a, thank you for registering. Don't forget the event dates. Like Terry said, there's a reminder to block your calendar for the event dates to hopefully prevent too many meetings coming up for those 2.5 days so that you can focus on the event. So just a kind of a checklist, a few reminders. And then also within that email is simple text that you can copy and paste and put on your social media networks, just letting them know that you're attending NAHQ Next, helping again to spread the word for quality. And then very important, a few days before the event, the week before, maybe 3 or 4 days before, you will receive an email to the same email that you registered for the event with. And within that email, we'll have access instructions. So it will have a link to access the actual event platform and directions for your login. So you'll want to make sure that you're looking out for that a few days before the event. And then we highly recommend that once you receive that access email, that you just test your login. Just simply click on the link, log in, make sure you can log in, and then make sure you can see a couple of the tabs. We find it very helpful to do that, the day you get the informational email rather than waiting until Monday morning when the event starts and 5,000 plus people are trying to log in. So we just recommend trying ahead of time.
Yeah, great. All right. That's at this time, we'd like to open it up for questions for you all, and I'm going to help with curating and asking the questions on behalf of our audience. We have had a few questions come in. One question, how do you register the hours that you attend for the live sessions? I'm assuming they're speaking about those CE hours. Jackie, would you like to take that?
Sure, I'm happy to take that question. So once you attend a session, when you go to complete the evaluation, all the sessions will be listed on the evaluation. So you just complete the individual session evaluation, and then at the end of it, you will complete an overall evaluation. And then once you complete the evaluation, you'll be awarded your certificate, which will have the approval statements from the nursing contact hours, CPHQ and ACHE, and you'll just keep that for your records. And one new implementation that Allison actually led this year is the evaluation is super customer friendly. It's going to be right on the platform. So underneath each session, there'll be session handouts and then also a link to the evaluation. So it's all going to be right there.
Yeah, so hopefully this year, if anybody on this call that's been on NAHQ Next before, the evaluation process will be a lot easier, and we're excited to have you guys try it out this year.
And if I remember correctly, you want to make sure you do all your evaluations before you submit your final thing, correct?
Correct, yes. The goal is you will, since the session evaluations will now be right next to the session player, hopefully you can review it quickly after so you aren't having to go back, a week later and fill it out. You complete those sessions and then you'll have also the overall event evaluation to complete. So all of that information will be in the platform itself. We'll have directions and how-tos, so and our customer service team will be ready to help out as well. We had someone else ask to put the QR code up for registration again, so here it is. I'm just going to have that on the screen for a little bit while we finish Q&A. We have a question about, is the agenda available in a print-friendly format? It's currently available online on our NAHQ Next website. You can print the pages from there. Like we mentioned, we will have a program book, which can also be downloaded in PDF version that I'm sure could be printed. Yeah, you can check out those resources for that. You can visit next.nahq.org. How many nursing hours for this event? Jackie?
I believe it's 41. Like I said, we just submitted our CNA application a couple of weeks ago and just got it back, so we're working on the hours, but I think it's going to be 41.
Great. One second, I'm just going through. Yep, someone had asked, I really want to attend, but I'll be traveling that week. We'll be offering the opportunity to attend the sessions at a later date if you cannot attend on those dates. Jackie, Terry?
Sure, I'll take it. Absolutely. That's what's really great about this conference is you have till December 31st to re-listen to anything, including the live conferences. You'll have access to all of the takeaways, all the tools, all of the posters. So if you can't make it that week, we'd love to still have you register, and you have till December 31st, 2024 to access everything.
Yeah, it's great. You have plenty of time to replay it and review, and you can still get those CEs just as if you were live. So
And even if you watch the session when it's live, the full session, you can still go back December 29th and rewatch it if you want to pull things out of there. So it's unlimited access until end of year.
And in addition to that, most, if not all of our sessions, we have the slide decks available. Like Terry had mentioned, we have HQ tools, so we have that actual tool. A lot of presenters will provide handouts, additional handouts as well, and that's all easily downloadable in the platform. We have had a few questions about CPHQ, and for those folks, I'll follow up with you separately about certification. We will not be having an info session for CPHQ during NAHQ Next, but we do offer those, so I can share that with you once we get off of this webinar. But thank you for your interest, and I'll be sure to reach out to you. Let's see, one more question.
And I just recertified, I think it was last week, early. And like Jackie said, one conference, you have enough of your credits for your every 2-year cycle. So I had more than enough credits to do my CPHQ.
Great. We have another question. Is there a NAHQ Next app available? Like we had mentioned, that we do not have an exact app, but the platform is available on your mobile device. So you can access that through a web browser on your phone or tablet, and it should play just like as if you were on your desktop, same quality, so you can access it that way. We do have a question about how many hours for nursing executives.
The CE that we apply for is just the continuing nursing education. So it's just the general CNE and then ACHE, which is healthcare executives. And that one is 20. And the reason is because they, and Allison can correct me if this is wrong, but they take full hours only. So for those, remember when I was mentioning we have the 15-minute bite-sized sessions, all 4 of them count as 1 hour because it has to equal 1 hour of content.
Yeah, so we can only offer those 20, but the other ones should, for CNE and CPHQ CE, should be up at about 40, and we'll have that confirmed hopefully in the next week or so.
Mm-hmm.
That's all the questions I have for today. Anything else from our speakers today?
Allison, just one thing to mention about the 40 hours of CE. All the content is where CE, even the posters. So to get that 40 hours, you watch all the on-demand, including the poster sessions.
Yes, that's all of the sessions combined, and you can get awarded partial credit as well. So you do not have to complete everything, although we would definitely recommend it. So thank you for today for participating in the info session. To register for the event, please visit next.nahq.org. That link is in the chat as well. And please don't hesitate to reach out to NAHQ if you have any questions regarding the event. And we'll see you on September 9th for NAHQ Next. Thank you.
See you all
Thanks.
soon.
Bye. I thought it went good.